Hello, my name's Roy Wooldridge from Win Health Limited, and I'm here today to talk to you about some of our new products. Today we're going to talk about the Makey Palm Bladder Scanner version 4.1. Press the power button and the indicator light will turn to green and you'll be in the screen which says Ready. Press the up button to choose the female gender. Male. In pediatrics mode, it is only suitable if the urine volume is less than 100 milliliters. 2 centimeters from the pubic bone. Place enough gel onto the area. Disinfect the probe. Place the probe on the gel with the smiley face toward the patient's head and then tilt it 10 to 30 degrees forward towards the head. Press the scan button to enter the pre-scan mode. The bladder image will be displayed. Move the probe up and down and adjust the angle of lean slowly. Maximize the dark space of the bladder volume. Move the probe left and right slowly. While the dark space is in the middle of the sector, moderately press the probe until the image is displayed clearly. Keep the probe steady. Press the scan button again to enter the scan interface. Test result. Press the print button and print out the result. Press the power button to power off and clean the probe. After scanning, press the up button to check the first 6 images. Press the up button to check a further 6 images. If all 12 images show a red envelope line, then you have an effective result. If the red envelope line was obviously smaller or bigger or deviated from the bladder edge, then the testing result was ineffective and you need to do a rescan. There are a number of reasons you may get an ineffective testing result. If you do not use enough gel, the bladder edge may not be clear. If you place the probe in the wrong position, parts of the bladder are out of the scan range. The probe has been moved or shaken, or the pressure of the probe is not enough when scanning. Maybe the patient coughed and the abdomen moved. Press the up button when in the test result interface mode. To confirm the effectiveness of all the images, press the left button. Now you can enter into the ID Edit interface to input the patient's identity. Use the touch screen to create your patient ID. If you make an incorrect entry, use the delete key. Then touch the Save button to save your data. The scanner will then revert back to the Ready interface and you're ready for the next scanning. Press the left button when you're in the Ready interface. Press the up and down button to check the previous testing results. Then press the print button to print the reports. Press the right button to get back to the Ready interface. For obese patients, reduce the probe lean angle to the patient's head or lean the probe to the patient's feet. For bladder deviation patients, put the probe above the pubic bone and move it to find the best position. Bladder fibrosis patient, that is bladder diverticulum patient, put the probe 2 centimeters above the pubic bone and then deviate it 1 centimetre to the right side. Choose the largest dark space, but not the largest bladder border. Prostate enlargement patient, put the probe 3 to 4 centimetres above the pubic bone and avoid the prostate. Post-void residual volume, put the probe 2 centimetres above the left of the pubic bone. Bladder contraction with difficulty before testing, you need to massage or hot compress the bladder for several minutes. And bladder volume more than 500 millilitres, the probe needs to be put 3 to 4 centimetres above the pubic bone.